This morning's Business Insight, Garen Colvin is a Northern Kentucky guy through and through. He's a 1982 grad of Ludlow High School and a member of the Northern Kentucky Sports Hall of Fame. He received a scholarship to play baseball at Thomas More College, where he earned a bachelor's degree in accounting and business. He has an MBA from Northern Kentucky University. Colvin joined St. Elizabeth Hospital in 1983 as a co-op student. Over the years, he has served as Vice President of Finance, CFO, COO, and interim CEO. And last week, he was named CEO of St. Elizabeth Healthcare, which is the largest employer in Northern Kentucky and the dominant medical provider there. He is with Business Courier reporter Barrett Brunsman in the studio. Gentlemen.
Thank you, Peg. Garen, you've been at St. Elizabeth for more than 30 years in various capacity, so you probably know more than a few of the 7,300 employees there. But just in case there are a couple you haven't crossed paths with, how would you describe your management style?
I think I try to lead by example, and in addition to that, I try to focus on relationship building and consensus building with my leadership team.
Great. St. E is the biggest medical provider in Northern Kentucky, has been for years, and yet some other hospital systems on the Cincinnati side are making some incursions. Both UC Health and Christ Hospital have invested millions of dollars recently to try to chip away a little bit. What will St. E do under your leadership in terms, would you consider expanding any service lines or new areas for facilities in Northern Kentucky to compete with these guys?
We're constantly reviewing service lines that make sense for us, but for the most part, we will maintain our commitment to quality and maintain our commitment to the patient experience. All decisions that will be made going forward will be made with the patient, our physicians, and our associates at the center. We also would like to make sure that the patient experience is one that would prevent our patient from wanting to choose another system. And I think our technology with the electronic medical record, Epic, we have MyChart. So we're approaching 60% of the patients within our physician organization, St. Elizabeth Physicians, are utilizing MyChart. That's well above the national average. So that gives the patient the ability to access test results same day. It gives the patients access to schedule appointments online and also to have electronic visits. We call them e-visits, so they can actually use that technology. So we're trying to provide access to our patients where they want to see that access.
Speaking of the types of things that you offer to patients, you have a history in sports. You're in the Northern Kentucky Sports Hall of Fame. What sort of sports did you play in high school, and does St. Elizabeth have any connection to sports?
Coming from a small school, I had the luxury of playing all three, baseball, basketball, and football. And then later going to Thomas More, I concentrated on baseball. At St. Elizabeth, we've always had an emphasis on sports medicine. So we work with a lot of the local colleges and high schools, and we provide athletic training in cooperation with Commonwealth Orthopedic, who are the physicians in our Orthopedic Institute. The Orthopedic Institute is an institute that includes St. Elizabeth Physicians, St. Elizabeth Healthcare, and Commonwealth Orthopedic physicians.
Before you became chief executive, you were chief financial officer at St. E. Seeing little things about finance, you're going to oversee a budget of $1 billion annually. Do you anticipate any cuts going forward?
No, I think we've done a great job at St. Elizabeth of being proactive, anticipating the changes that are coming in healthcare reform. As payment methodology changes, we'll have to adjust our expenses, but we've done a great job of managing our expenses to this point, and we don't anticipate any changes, definitely in 2015 or 16 as we prepare that budget.
Well, thanks, Garen. And finally, you've been CEO just about a week. Any reaction from the community?
I've been overwhelmed with the support from our community, our physicians, and our associates. It's quite impressive.
Great. Thanks so much for joining us today.
Thank you very much.